Hello, everyone. It's Wednesday, December the 14th. I know we're a little late getting started here and everything. We just had an incredible meeting with the Mongolian ambassador, and that is correct. And what I'm saying, Mongolian, you know, the ambassador was here and several of his folks and several of our people, you know, from Mike Graney was here from Economic Development, and lots of different people, you know, Senator Senator Nelson, excuse me, gosh, I can't even talk. Senator Nelson was here as well, and a lot of our people and everything. We had a really productive meeting. It was all really good, and so with all that being said, we look forward to being able to do business, you know, from West Virginia with Mongolian, adventures or Mongolian, opportunities. And so it was just a, early meeting and everything, but productive meeting. And we're always searching for more and more opportunities for West Virginia's goods and services and opportunities. So nevertheless, let me get back to just this. We've had an additional 11 folks that have died. Our total now is 7,649 people. I ask absolutely always for your prayers, but for your respect. Please, please, please don't let these people feel alone. The 7,639th person in West Virginia is a 61-year-old female from Monongahela County. The 7,640th person in West Virginia to pass away from COVID is a 75-year-old male from Boone County. And just to say, I don't know what, I've got a little tickle in my throat, but please forgive me. The 7,641st person is an 83-year-old male from Wood County. The 7,642nd person is a 47-year-old female from Marion County. The 7,643rd death is a 91-year-old female from Putnam County. The 7,644th death is a 50-year-old female from Boone County. The 7,645th death is a 56-year-old male from Fayette County. The 7,646th death is an 81-year-old male from Wyoming County. The 7,647th death is a 69-year-old female from McDowell County. The 7,648th death is an 87-year-old male from Raleigh County. The 7,649th death is an 84-year-old female from Kanawha County. Okay. We have 941 active cases now in West Virginia, 378 new positive cases in the last 24 hours. Daily positivity rate is 6.84. Cumulative rate is at 8.53. Recovered cases, almost 610,000. 190 people hospitalized, 22 in the ICU units and 6 on ventilators. Most of the counties are green, 10 counties are yellow. I asked absolutely for your prayers for those folks that are in the hospital. It's a tough time of year, and, it's just, we have so many blessings and everything. Let's hope and pray we get all those folks out of the hospital and they're in good shape. I remind you about getting your Omicron booster shot. If you're 12 and older, you're eligible, but especially those 50 and older, we really need to do that. We really need to do that really badly. The vaccine calculator can assist you on when to remind you about this and everything. I absolutely also encourage you about your flu shot. We're getting overrun all through this country with RSV, flu, and COVID. So absolutely, we know that we may be able to impact the flu with your vaccine. We know we can impact COVID with your vaccine and everything, and take an awful lot of load off of our hospitals all across this country. The numbers, continue, like I said, over and over to get little by little better. The vaccine calculator and the COVID vaccine info line are up there on our websites. There's 47 outbreaks in our long-term care facilities, none in our church community. We have 35 inmates and 19 staff cases. Corrections is doing a great job. I always encourage you about giving blood. Check with your physician first. And if they give you the go-ahead, then please consider. I've told you about our DNR lifetime license giveaway. and that's for, hunters and anglers that buy their license for 2023 in December right now. You'll go automatically into a drawing and everything, and who knows, you may very well be a big-time winner of something that is tremendously valuable, and that's a lifetime hunting and fishing license. And if you're an out-of-state, entrant and everything, you can win great, vacation stays at our parks and a lot of good stuff there as well. Yesterday I announced the new leadership of DHHR, and that's Dr. Jeff Coben, the Associate Vice President for Health Affairs and Dean of the West Virginia University School of Public Health, as our interim secretary and everything. Dr. Marsh and retired General, or I don't ever use retired, I don't know why I said that, but General Hoyer have decided and have, I've surely requested, and they asked, and I asked them if they would sign on as advisors and absolutely get into this, dig into it really deeply, and they're joining me today, and they'll have some comments here in just one second, but I can tell you, just like we did all through the COVID situation and everything, we jumped on this and we jumped on it with both feet. We have made absolutely instant, recommendations and instant moves. I really will pass on to them. I can read through all the different things that they've done. Let me just tell you, just yesterday, my team identified some of the bottlenecks in our hiring process. Why are we taking too long to get people in place? And once we were able to break through the bottlenecks, we successfully extended yesterday offer letters to 3 CPS workers and 1 youth service worker in the Eastern Panhandle. Once they accept, we will get them on board ASAP. These workers will address immediate needs in the Eastern Panhandle. And these are needs that, Senator Trump brought up and everything. Great stuff. Today we have authorized the CPS hiring bonus for CPS workers and everything in Morgan, Berkeley, and Jefferson counties. There is already in place a $2,500 signing bonus in our state. We've moved that to $5,000 in these areas and everything because these areas are, the cost of living and everything there is surely more significant, and we want to try to help, in every way we can. We have issued an executive order which allows people who have retired from DHHR to come back on a limited basis to help get things, help in any way you possibly can. The executive order allows them to do so while still drawing their full retirement. And we did the same thing during the COVID pandemic. We just are running a playbook that we learned a lot about, in COVID and everything. It works because our retirees have knowledge, of the inner workings and everything, and they can assist us and help us even more. And so we're anxiously looking, to be able to do that too. And like I said before, this crew, I will promise you, hits the ground running. There's no slowness here and everything, and everybody knows, that we just want to make things better. That's all I can say. And the great part about it is all 3 of these people, whether it be Dr. Marsh, General Hoyer, or Dr. Coben, they're not paid a dime, not one dime. It is amazing and everything. So we step up, and that's what we do. A Prodigy announcement, we made another big broadband announcement yesterday. The state has once again teamed up with Prodigy West Virginia to get our people connected in a reliable and high-speed way. Construction is already underway in Preston County to construct 150 miles of fiber optic network, and there's lots and lots of good stuff going on all across our state in broadband. We're going to just keep it up, and we're going to keep trying to pour it on and everything and do all we possibly can to get more and more and more people in really rural areas connected. There is a winter storm warning, for the Eastern Panhandle, and I think they're expecting up to a couple of tenths of inches of possible ice. That's very, very dangerous, and so please be super careful at this time of year. A lot of people are moving around. There's a lot of traffic on our highways and everything. A lot of people are shopping, whatever it may be. We got to be really, really, really careful at this time of year. I don't know if this is the case now, but in many years. And this was amazing to me when it was told to me, and dumbfounding in a lot of ways too. I think the single day where there's more traffic accidents and maybe more fatalities in this country than any other day is Christmas Eve. And so please be really careful. It may not be that way today, but I know Christmas Eve is a really dangerous time to be on the highway. So watch what you do and be really careful. And we've got a DOT announcement that's going to come at right after I finish my briefings today, and we have two really exciting announcements from DOT and DMV. So nevertheless, stay tuned for that, and that's all I've got for right now. Thank you.
All right, thank you, Governor. Let's now go to Dr. Jeff Coben, the Interim Secretary of DHHR.
Thank you, Jordan. Thank you, Governor Justice, and I want to thank you again for your faith in me to assume this interim position. I'm honored and humbled to do so. This week, it's been a very busy week. We've met, of course, with the governor's office and with senior advisors, Dr. Marsh and General Hoyer, as well as the key staff and leadership of the Department of Health and Human Resources. And again, I just want to acknowledge the dedication and the abilities of the leaders and the staff throughout DHHR. As the governor mentioned, we've been aggressively moving forward to address changes and to enhance the workforce. There was recently a hiring freeze at DHHR. We have immediately lifted that hiring freeze to try to enhance and improve the workforce. And I'm pleased to report that of the 4 individuals that the governor mentioned, we extended offer letters to yesterday. We've actually already had 2 of those individuals sign on and join us in the effort to improve our child protective and youth services in the Eastern Panhandle. So that's great progress, and we will continue to move forward as quickly as possible. So if you need a job and you want to join the dedicated team and staff at DHHR, we're hiring. Go to our website, click on the employment at the top of the page, and please, if there's any way that we can help you navigate, let us know, and we're happy to do that. We've been able to work through some of the hiring issues, both within DHHR and with our Division of Personnel. And we're working with the Division of Personnel to clear out some lists of potential applicants who may want to work at DHHR, but have had some problems navigating through that system. So I think some great early progress, and we will also immediately begin to further recruit for our workforce needs by reaching out to our high school programs, the Mountaineer Challenge Academy, our VOTEC, and as well as the health sciences students and others throughout the university, and the Jobs and Hope program as well. We think can serve as a great source of individuals who have connections, deep connections within the communities throughout the state to help enhance our workforce, as well as ensuring a pathway for this next generation of West Virginians to continue with DHHR's critical mission. And finally, we're working on plans to acquire some additional technology that will allow our people to work smarter and more efficiently as we manage cases that are in the system, both now and in the future. So that's just a brief update on some of the things we've been working on in the last 48 hours. Thank you, Governor.
Thank you, Doctor. Thank you so much.
All right, thank you, Dr. Coben. Next, we'll go to Dr. Clay Marsh.
Well, good morning. And as the governor and interim secretary Coben have told us, that we still are navigating COVID-19, And the variants that continue to evolve in our country and in our state are derivatives of the Omicron BA.5. So BQ.1 is becoming our largest variant in our state and also in our country. And this variant has the ability to evade the immune system in a more hardy way, a more powerful way than previous variants have. And therefore, it's really, really important, as the governor has mentioned, for West Virginians, particularly those West Virginians over 65, to really seek their updated Omicron booster shot. Across the country, about 34% of Americans over 65 have gotten their Omicron booster shot. And we know that this vaccine does have activity against these new variants. And we also know that getting up to date with your vaccination not only protects people from severe consequences of COVID, hospitalization, and death, also reduces the risk of long COVID, as does the use of Paxlovid, an oral medicine that can be used in the first 5 days after somebody develops symptoms with COVID infection. And Paxlovid reduces the risk of long COVID at any age with any previous history of COVID or any vaccination history. So it's really important that people go ahead and test themselves and then report their positive test if they have it to their healthcare workers. So consideration of giving Paxlovid can be done, because Paxlovid reduces the risk of long COVID by about 26%. And we know from recent work that a group of Americans has now been found to died specifically from long COVID. And remember, about one in four people who have finished having COVID-19 develop symptoms of COVID, persistent symptoms for a month, and about 10% for greater than 3 months. So this is something that we want to protect people from. And we also know that today about 90% of people dying of COVID-19, again, are over 65 years old. It is becoming a disease of our elders. Related to DHHR and our role in assisting, I want to reinforce what Dr. Coben said. We have had an opportunity to meet with many of the leadership of DHHR. And what we're finding is these are really talented and really committed servants to our state. And we owe them a debt of gratitude, particularly at this time in West Virginia that we've been going through this very long pandemic. As we met yesterday with our leadership team and members of the governor's office, we went through and tried to prioritize where we thought that the most important needs for the state of West Virginia are, and that's focusing on our most vulnerable population, our children and our elders, and certainly looking at making sure that we have the right team, the right workforce to be able to bring the care that these vulnerable West Virginians need to them. And then starting to extend the focus to the mental health crisis that is currently in not only our state, but our country and even beyond that. And then the issues with substance use disorder, which West Virginia leads the country in substance use related deaths, addiction related deaths. And also we know that during the 2021, we saw 100,000 Americans die of deaths of addiction. And so we want to make sure that we are addressing those issues as well. And as we think about the real role and the goal of DHHR, which is the same role the governor has articulated to us many, many times, which is to provide the best in healthcare for our citizens and its access, but also to commit ourselves to improving the health and the well-being of each West Virginian. And that truly is a mission that is a binding one for all the people that we have dealt with at DHHR, and certainly for all of our leadership team and the governor. Thank you.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer.
Good morning. I'll cover COVID first. As far as our joint interagency task force, primary objective right now is to work with hospitals and providers, pay attention to what the governor talked about earlier, is that trend that's coming across the country with flu, RSV, and the next variants of COVID. As you all will remember, throughout this process with COVID, we usually, just by the rural nature and transportation corridors and things of that nature, we usually tend to be 3 to 4 weeks behind the surge nationally. So we've got to be prepared to work with everybody regarding that. As you have heard in the numbers, the age numbers of those West Virginians that we've lost, that the governor goes over every day to make sure we remember those West Virginians. And if you look at the data that's out there now, if you're over 65, you got to think about the flu shot. You've got to think about that booster. You've got to think about taking those precautions because over 70, particularly with Omicron and Delta, has been the most vulnerable of our population nationally, and clearly in West Virginia. We're seeing that. So we've got to pay attention to that. If you're over the age of 65, please take those precautions, get those opportunities to get the booster. As it relates to DHHR, as the governor, Dr. Coben and Dr. Marsh pointed out, we had the opportunity to spend a lot of time with senior folks in the organization, a lot of folks who really care about taking care of folks. As we pointed out before, the governor, when he talked to Clay and I about taking on this responsibility to assist him, it was really, really clear that this is important because it is focused on our most vulnerable population, our most vulnerable fellow citizens, whether they're young or old. The governor tasked us to work with all the different constituency groups, and we'll leverage the partnerships we built with the Joint Interagency Task Force to get to those groups and work with everybody to understand the challenges as we work through this. And he also tasked us to do, I think, what you saw a result of that Jeff announced today, and that is bust through bureaucracy if bureaucracy is holding us back. And we'll continue to work to do that. And the last thing he tasked us with was to be bold and do the things that we need to do, and we need to recommend to him to make this work for our most vulnerable population, and we will do our best to move forward with that. Thank you.
Thank you, sir. We'll now go to questions from members of the media. The first today from Randy Yohe with West Virginia Public Broadcasting.
Good morning, all. Randy Yohe here from West Virginia Public Broadcasting. Dr. Coben, welcome to the table, sir. Governor, before this laundry list that we heard of this action that you've taken with DHHR, Senate President Craig Blair and others have vowed to renew their efforts to separate DHHR into two departments, and many seem to not want to wait on seeing any fruits of the McChrystal study implementation. So how do you reach common ground?
Well, Randy, I appreciate your question. I would just say just this, and here's something we should always remember. What are we doing this for? I mean, we're doing this for our people, are we not? There was a time back in COVID, there's been so many times back in Roads to Prosperity or whatever it may be, that we could have jumped too fast. And I'm a real believer, when you jump too fast and you do it irresponsibly in order to be able to get on a soapbox and rah-rah the people and act like you're doing something, and that's not wise. And we know it's not wise. And what have we done? I mean, let's just be brutally honest. DHHR has had its problems for decades and decades and decades. That's all there is to it. Now, along comes justice, and we've fixed lots of stuff, have we not? Now, and we're going to fix DHHR too. Are we going to make it perfect? No. Only one made things perfect. We can't make it perfect, but we can make it a lot better. So what do? We do the prudent thing. Instead of just jumping, to make a splash and to get on a soapbox, what we did is we got the very best of the best of the best, McChrystal, to come in and do a top to bottom evaluation and then give us their report and then try as best we can to follow that report. Secretary Crouch was good enough to stay around long enough to get the McChrystal report. There's surely things that Bill Crouch could have done a lot better, but Bill Crouch did a lot of good. And we need to be thankful for his service. That's just all there is to it. And it's been mentioned over and over and over from Dr. Coben or Dr. Marsh or General Hoyer of how good the folks are in DHHR. They don't need to be kicked around. They just don't need to be kicked around. What we need to do, we got Charlie Trump that I've got so much respect for and love and just think he is a super mind. Sent us a letter. And really and truly, I read through the letter and looked at it and absolutely, Charlie, I thank people. I thank people for constructive advice and ideas on what to do. Absolutely. So we move. Now, with all this, there is so much movement that has to be made to really make an agency of 6,000 people in every way a lot better. We can just jump. We can just jump for the sake of saying, look what I did here and there. But really and truly, at the end of the day, we want to be bold in what we do, but we want to be smart in what we do. Now, do we not get that? It's one thing to be bold and just jump, and it's another thing to be bold and get the best people in the business to give a top to bottom evaluation and then jump. So at the end of the day, I think we're right on the right track. We've got the best of the best of the best of the best. I didn't think they'd do it. I really thought when I called Dr. Marsh and General Hoyer, even though it's as good as they've been and everything, they have been such loyal servants, it's been off the chart. I didn't think they'd do it. But I asked them with all in me to come on board. We've done such good stuff with COVID. Come on board here in some way, guide and direct us, and because they are experts in these fields beyond belief. With all that being said, I think Secretary Crouch's retirement, although regretful, is an opportunity. It's an opportunity to move forward with some real superstars, and Dr. Coben will do an unbelievable job as acting. And with all that being said, what we will do is be an absolute search nationwide, worldwide, whatever it may be, to come up with the best leadership we can come up with. But first and foremost, we've got to act now, and that's what we're doing. So, Randy, I can't say it any more bluntly than that. This idea of just, coming up with an idea and then running up and jumping up and down and, and undermining and literally say what you want. But, that was the situation with the gentleman that got let go at DHHR. It was undermining. It was not support. It was just a constant undermining. And so with all that being said, I am absolutely for things being better. But I'm for a smart way and a smart pathway and not just a jump on a soapbox. That's all I can say.
All right, thanks, Randy. Next to Mark Curtis with Nexstar Media.
Good morning, Governor and cabinet members and fellow reporters. Governor, on a completely different subject, and I fully realize that when you became governor, you put the majority of control into the Justice family companies with Jay and Jill. But there are reports out there today that the Justice companies have been fined, specifically Bluestone Coke, approximately $900,000 to $1 million for some environmental problems that were caused in Alabama. I'm just wondering what your thoughts are on the fine and what, if any, remediation is being done to remove that problem if it hasn't already been done so.
Well, Mark, let me tell you the honest truth, and this is, I don't know how to say it any better. When I first got knowledge of it, was when it came out in the Charleston Gazette. And that's hard to believe, but that's absolutely the gospel fact. And the other thing I tell you is, go back and find a time when I've ever told you something that is not absolutely the truth. Now, I can tell you this. There was that asset that the family owns is a Coke plant, and I've never been there. I've never set foot on the property. I've never been there in my life. I've never talked to the people down there. I mean, my son purchased that, I don't know, 5, 8 years ago, whatever. In all of that, it's old. It's really, 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 really old. And so the plant, they tried to operate it for a while and everything. The plant was on its last legs, and the plant had to be shut down. Now, with all of that, I think there was some lingering, I guess is the right word, environmental issues that they're all over. They've now settled those environmental issues, and they're doing whatever that has to be done to finalize that situation. I don't know any more than that, but I know the outcome, I think, is a pleasing outcome to all parties. And so I know from the standpoint of talking with Jay thought it was a good outcome, and it was an outcome to move forward and everything. So I think it's good, but I don't know any more than just that.
All right, thanks, Mark. Next to Charles Young with WV News.
Hi, y'all. This is Charles Young with WV News. Governor, in the month or so since the election, it seems like the priorities of the legislature have shifted from tax reform to these DHHR reforms. Are your expectations for the upcoming legislative session that we'll still see some kind of significant tax reform package? Do you think that's going to take a back burner to these DHHR issues? Thank you.
Charles, this can be the craziest place in the universe. That's just all there is to it. At the end of the day, what are we here to do? We're here to do the people's will. The people. And the people spoke, did they not? Did they not speak, and did they not speak emphatically? Did they not speak and say, in a situation to where we were running out, and I like it or not like it, it's just the truth. Charles, we tried to hoodwink the people. Not me. The powers to be that were trying to run this Amendment 2 deal, they clothed it by get rid of your car tax. And the people had no idea what Amendment 2 was truly even about. We hoodwinked the people. It's the worst thing on the planet to do to West Virginians. And so with all that, I tried to negotiate, tried to do everything in the world. It was just Stonewall, 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 Stonewall. Now, and so then I went out on the road and I talked to the people. At that time, Charles, Amendment 2 would have passed 85-15 because our people didn't know. But once they absolutely knew, think about it. Think about the police departments and the fire departments and the schools and on and on and on. Think about what they did. They absolutely just rubbed everybody's nose in it. They said, no, to the level of 65% to 35%. Said, no, we don't want this. What we want is local control, and we want tax cuts absolutely to the individuals and not to maybe great big out-of-state companies. Now that's what they want, and that's what the people said. So now here's all there is to it. It's as simple as just this. From the legislature standpoint, if they ignore the people, or they go another course that says, well, I'll tell you what let's do. Let's just go back and rebate all of Amendment 2 and forget the people. They're not doing this against me. They may try to clothe it that way again, but they're absolutely going against our people. That's all there is to it, Charles. I mean, literally, at the end of the day, if we don't do meaningful tax breaks to our people, then we are absolutely just thumbing our nose at our people. And I'm not going to be for that. I'm going to stand with our people because absolutely the will of the people was spoken. Now, what they should have done if they were smart is as soon as the vote came out, they should have said, listen, we wanted to go another way, but we hear the people. We hear the people, and we're here to do their work. And so therefore we move forward. And literally there's so much negotiation that can be done. We need to get on a pathway of reducing and get on a pathway of eliminating our personal income tax at some point in time. We need to absolutely, without any question, get rid of our car tax because we promised. We promised. We'll get rid of the car tax. We promised. But absolutely, we need to put meaningful dollars back in the pockets of hardworking West Virginians, and they will do great stuff for West Virginia with it. And then somewhere down the road, if we continue on this path of doing unbelievably well, then let's revisit the machinery and inventory stuff. But really, what we should do first and foremost, if we want to drive real growth to West Virginia, it is absolutely crazy to not believe that if we get on a pathway of reducing our personal income tax, we'll drive growth to West Virginia in people. We got to have people in West Virginia. You saw the other announcements that just rolled out? Well, for crying out loud, there's more right to come. And just give it another couple of weeks and you'll see another major announcement that's going to happen in West Virginia that I know about right now. Absolutely, with all in me, what we need to understand clearly is we are recruiting and we're bringing greatness to West Virginia as far as job opportunity. Now what we need to do is reward our people to where more people will move into West Virginia and give us that population growth. Now, I'm not going to be a baby. I'm not going to be a baby about anything. And really and truly, if they want to go a different way, override me, whatever it may be, they're not doing anything to me. I mean, for crying out loud, they're snubbing their nose at the people's will. And that's lunacy to me.
All right, thanks, Charles. Next to Kim Rafferty with WSAZ.
Good morning. My name is Kim Rafferty with WSAZ. My question is for Interim Secretary Dr. Coven. What are some of your priorities now that you are Interim Secretary? What changes are you going to make, and how many people are you looking to hire?
Doc, it's you, sir.
Yes, sir. Thank you for your question, Kim. So, of course, the priorities are the priorities that the governor has laid out for us, and that is to move as quickly as we can to work with everyone within DHHR to address the most vulnerable populations that we serve across the state. That includes our elderly populations, our low income, and our children, first and foremost. So, as we mentioned earlier today, our immediate action steps are to try to beef that workforce up, to enhance that workforce. In terms of the actual numbers, there are a number of vacancies that we currently have. So our first task is to fill those vacancies as quickly as possible, to bust through any logistical red tape that we need to and get people on board. We'll also be looking at opportunities to expand additional positions to address the key priorities. In terms of the department as a whole, enhancing the workforce of the department, enhancing communications across the department, building the leadership team. These are all things that were recommended in the McChrystal report. And these are all things that we'll be actively working on over these next several weeks. I think on a longer term basis, there's an opportunity for strategic planning within DHHR to really identify what are the most important key priorities for the department so that we can optimize the functions of DHHR as we think about the future and how the department will function more effectively and more efficiently. So those are really some of the initial priorities that we're working on. Thank you.
Thanks, Kim. Governor, I'll turn it back to you.
Well, again, I want to just take time to thank Dr. Coven, Dr. Marsh, General Hoyer. Like I said, I didn't think you'd do it. I really didn't think you'd do it. But if there's ever an example in the world of going to a knife fight with 3 bazookas, that's it right there. The best of the best that we have to offer in every way, and they will really assist us, and they'll absolutely make recommendations, and they'll really move the ball. Now, if what we're trying to do is be on a soapbox and show our hind end, you know, that's one thing. If what we're trying to do is make things better for West Virginians, we really are all about trying to do just that, and that's what we're going to do. So with all that being said, I take just this, you know, about what Dr. Marsh just said, or General Hoyer. Now, I think this is Dr. Marsh. He said we work toward our health and well-being of our people and community. You know, Dr. Marsh has said it over and over and over. You can't believe how community-minded Dr. Marsh really is, and how much better he wants it for all West Virginians, and how great a job that he's already done, along with General Hoyer, along with Jeff Coben, so many others. Along the way, we all pulled the rope together, didn't we? We pulled the rope together when a lot of people were distracting and wanting us to do this and that and everything, and West Virginians, whether it be all the great health workers, all the great first responders, all the great EMSs, all the great people at the grocery stores, and everybody across this incredible state, we pulled the rope together, didn't we? We made it better, and that's what we need to do right now too. Thank you so much.